It is time for Call of the Week now. We get to do a little bit of medical detective work and sleuthing to get down to the bottom of the issue. Obviously, an interaction with your doctor face-to-face is first prize, but if you don't have access to that, a phone call is the next best thing. And it's so important to learn to give a good history, give as much information as you can to help your doctor make the best decision he or she can. Not so, Seth.
That's right, Sherlock. We get a lot of calls from people reporting that they're feeling tired, weak, and generally just not feeling themselves. Often the answer is simply that they're under a bit of stress, they have an underlying iron deficiency, or are simply not getting enough sleep. But when a young man requested a house call last week, let's call him Gabelo, he reported a few more interesting symptoms. In addition to just feeling yuck, he told me he was also experiencing headaches, vomiting, back pain, and extreme sweating.
Oh, sounds like he was feeling pretty miserable. I mean, some of the most common causes for those group of symptoms are fear and anxiety, pregnancy, which I think we can pretty much rule out in this particular case, the flu, low blood sugar, or what we call hypoglycemia. You get a stomach bug or food poisoning. There is tick bite fever, there is malaria, and meningitis. So a long list of possibles.
Well, he said his symptoms have been around for about 2 days, but they seem to be getting worse. He had assumed it was a virus or something minor, which is why it had taken so long to make contact. He said that while he really didn't feel like eating much, he had been trying to get something down. The only thing he could face eating was Marmite toast and Coke, neither of which made any difference to how he was feeling though.
So, well, the Coke, not that it would have been my first choice, but hey, it's not called the Red Ambulance for nothing, would have been sufficient to kick his blood sugar back up. So I think we can tick off hypoglycemia or low blood sugar off the list.
Yeah, I agree. He also couldn't recall any dodgy meals that he'd eaten before he started feeling so grim. And as far as he knew, he hadn't been around anybody with gastro, and he wasn't allergic to anything besides the Springboks losing to Wales. But that hasn't happened.
Let's hope that doesn't happen. That won't happen. Never.
Touch
Never.
wood.
Yeah. You know, we often immediately blame chicken for food poisoning, but in a lot of cases, it's actually vegetables that are to blame. I mean, one of the more recent reports showed that lettuce and spinach are in fact the more likely culprits. Hepatitis A, for example, is spread via contaminated food or water and infects millions each year, and that can make you feel really lousy. I think the moral of the story is that you need to thoroughly clean all your fresh produce rather than pointing your finger at the poor chicken.
Thanks for the quick lesson, Doc, but we are digressing. Because he had been experiencing the same symptoms for a few days, I was able to rule out the gastro and the food poisoning, which in most cases only lasts for about a day anyway. He said he had had a bit of a cough, but they didn't have a snotty nose. Symptoms had come on gradually rather than all of a sudden.
Which is important. I mean, that means we can scratch flu off the list because that hits you hard and fast, usually within a few hours, unlike a cold that develops slowly.
Besides feeling a bit stressed out about his symptoms, he said he was generally quite a relaxed kind of guy, especially since he just spent a week camping in the Kruger Park with some friends.
Okay, having been on holiday could potentially rule out stress, unless he was worried a bit about the work piling up back at home, of course. And anxiety is unlikely if he rated himself as rather chilled. But I think the fact that he'd spent time at Kruger puts a very different spin on the story. Malaria and tick bite fever would be two strong contenders in my book. And one of the consequences, in fact, of untreated malaria is meningitis, one of the reasons malaria is so dangerous.
Tick bite fever generally incubates about 5 to 7 days, while malaria can take longer, anything from 1 to 3 weeks. He said he had been back for about 2 weeks, and he sheepishly admitted that he hadn't taken any anti-malaria medication.
No, bad boy, wow.
He told me that because he was going out of the rainy season, he felt that he wouldn't be at risk and would rather just use a mozzie spray.
You know, while malaria medication isn't always 100% effective, it has been used successfully for the past 10 years in preventing malaria. I mean, another common reason that people don't want to take malaria medication, besides preferring the gin and tonic method, of course, is that they need to continue taking medication for up to a month sometimes after being in a malaria area. However, there are alternative options available, so it's always best to talk to your doctor about what would work best for you. Just don't forget to talk to them before you go bundu bashing.
Now, as you mentioned, if left untreated, malaria can cause some serious damage, especially to the brain. And since, in my opinion, this is where things were pointing, I referred him to his GP for blood tests. Blood tests are required to make both the diagnosis as well as to determine the best course of treatment. On follow-up, his GP confirmed that he did have malaria and started him on treatment.
Sure, good call on the referral, Doc, and I think it's safe to assume that Kabelo won't be going camping again anytime soon, only with his cooler box. This case, closed.